Welcome to America's Home Place 2024 Open Enrollment. First, let's start by meeting our Arista service team. You can call their Employee Benefit Assistance line at 866-370-3119 or email them at help@aristacg.com. They can help you understand your benefits, help with enrollment questions, claim issues, finding providers, or getting ID cards. Visit our new benefits website at the website link on the slide or also by scanning the QR code. You'll find lots of information about our plans and details that you can share with you and your family. What does open enrollment mean to you? This is your opportunity to review and make changes to your benefits, review your options, make your elections, or add and remove eligible dependents. All elections will be effective May 1st. And as a disclaimer, this is just a summary of the plan offerings. For additional information about the full plan benefits and plan eligibility, refer to a written plan document. Copies are available upon request. Open enrollment will begin April 8th and conclude on April 14th. This is an active enrollment, meaning in order for you to have benefits, action is required. We will be utilizing Employee Navigator, and a registration email will be sent to your America's Home Place work email the morning of April 8th. If for any reason you don't receive it or have trouble logging in, please contact Employee Benefit Assistance. Even if you're waiving benefits, we still need you to log in and provide beneficiary information. You will be automatically enrolled in employer-sponsored benefits, which include basic life, short-term disability, and long-term disability. Open enrollment is the time for you to make changes. Mid-year changes are not allowed unless you experience a qualifying life event. What's new and noteworthy? Again, we'll be using Employee Navigator to enroll in our benefits. We will have a new carrier, Anthem Blue Cross Blue Shield, with 3 medical options: a high deductible health plan with a corresponding HSA, a core national point of service plan, and a buy-up national point of service plan. Dental will include a high and a low option, vision insurance, accident, critical illness, and hospital indemnity as well. We will continue our partnership with Hartford for basic life and AD&D, voluntary life, and what's exciting is a brand new special enrollment for our voluntary life, which means a true open enrollment for employees and spouses up to the guaranteed issue limit, meaning no medical questions. And finally, the short and long-term disability. Here's an overview of the benefits. Eligibility for benefits includes any full-time employee working 30 hours per week. Your eligible dependents include a legal spouse, children up to age 26, or disabled children up to any age if disabled prior to age 19. Dependents who are not eligible include parents, in-laws and grandparents, siblings, nieces and nephews, and grandchildren. For more information about plan eligibility, refer to the written plan documents. Outside of open enrollment, the only time you can make changes include qualifying events. These include things such as marriage or divorce, birth, adoption or placement for adoption of a child, employment change or loss of other group health insurance, a spouse's open enrollment. You have 30 days to make that election from the date of the qualifying event. If you do go past the 30-day election window, you must wait until the next open enrollment to make the change. Let's take a high-level overview of the 3 medical plans that are available to you. Which plan is right for you? When looking at the high deductible health plan and you see 3 checks, those might be indications of which plan is best for you. If you'd like to have a tax-free HSA, which has no use it or lose it rule, and offers the opportunity to invest money for future medical costs, it might be the best plan for you. Also, pay the lowest premium, which may make it the least expensive option if you expect to have low healthcare usage. And finally, it might have the lowest possible out-of-pocket exposure for you. The core plan in the middle is a balance of your out-of-pocket and paycheck costs with a moderate deductible and premium costs. And finally, the buy-up plan. Pay the highest premium cost in order to keep your out-of-pocket exposure as low as possible when you need care at a doctor's office. Let's take a deeper dive into the high deductible health plan. The deductible is $4,500 for an individual and $9,000 for family. After the deductible is met, the insurance, Anthem, pays 100% of the costs. The deductible is also your out-of-pocket max since it is paid at 100%. All services, whether that is primary care, specialists, virtual visits, urgent care, ER, hospital inpatient or outpatient, or prescription copays, are all paid 100% by Anthem, but you must first complete your deductible. Biweekly healthcare premiums are shown below. Let's take a deeper look at the core plan. The annual deductible is $3,500 for an individual and $10,500 for family. Coinsurance is paid 70% by Anthem or 30% by you, up to no more than $7,900 for an individual or $15,800 for family. Some services only require copay, such as primary care physician, specialists, virtual visits at $0, and urgent care at $75. Emergency room is $350 copay, and then 70% is paid by Anthem. Inpatient and outpatient services are paid 70% by Anthem after the deductible. And prescription coverage is a $300 deductible for an individual, $600 for family, waived for Tier 1, which we'll cover in just a moment. And prescription copays include a $5 to $20 range for Tier 1, $45 Tier 2, $90 Tier 3, and 25% up to $350 for Tier 4. Premiums for those plans are shown at the bottom of the screen. Now let's talk about pharmacy. Level 1 coverage includes preferred pharmacies where your copay or share of the prescription cost is lower. There are more than 20,000 Level 1 pharmacies nationwide, including CVS, Walmart, Kroger, and more. Level 2 pharmacies have slightly more out-of-pocket costs when you fill your prescriptions at one of these 47,000 pharmacies, including well-known chains such as Walgreens, Rite Aid, Sam's Club, Costco, and Meijer. Last, let's take a look at your buy-up plan with a $2,500 individual deductible and $7,500 family. Coinsurance paid by Anthem at 80% and 20% for you, up to no more than $7,900 for an individual or $15,800 for family. Again, some services just require a copay, $25 for a primary care physician, $50 for specialist, $75 for urgent care. Emergency room is a $150 copay plus 80% coinsurance paid by Anthem. Inpatient and outpatient services, again, the deductible first, and then Anthem will pay 80%. The RX deductible is $250 per person, up to $500 for a family, again, waived for Tier 1. And prescription copays are Tier 1 $10, Tier 2 $35, Tier 3 $75, and Tier 4 25% up to $350. Premiums, again, are at the bottom of the page. As we transition to Anthem, we want to talk about applied deductible credits and rollovers. Let's first look at the left side of the screen with the high deductible health plan with an HSA. In 2024, between the months of January through April, the deductible and out-of-pocket max credit met between that time frame with United Healthcare will be honored with your new carrier, Anthem. As we move into May 1st with Anthem and your new plan year, new elections with Anthem will take effect. Prior carrier credit will be applied by mid-July. Over on the right side, let's take a look at your traditional copay plans. Let's first look at 2023 from October, November, and December. It's called fourth quarter rollover. The deductibles met between October 1st and December 31st with United Healthcare are rolled over to your 2024 plan year. This rollover will be honored and applied with Anthem mid-July. Let's look now at 2024. Prior carrier credit. Deductible and out-of-pocket max met between January 1st and April 30th with United Healthcare will be honored with Anthem. As we move into your new plan year starting May 1st, new elections with Anthem will take effect. Fourth quarter rollover and prior carrier credit will be applied by mid-July. As we think about optimizing your medical benefits, how can this help you reduce costs? There are 4 basic things that we talk about to help you lower healthcare costs. But it first starts by 2 concepts we've learned, which are to slow down and where you go matters. Find an in-network provider and schedule your annual preventative visit. Participate in the wellness programs and utilize appropriate facilities for care. What we're seeing below is a grid that talks about things such as emergency room, retail clinics, walk-in doctor's office, and urgent care. Each can be used for different things, but they take more time and they can cost different amounts. With an urgent care, that may only take 15 to 40 minutes, and there are things such as same-day walk-ins, you can do sprains, stitches, x-rays, then followed by walk-ins. Those can take a little bit longer, very similar to retail clinics, but they can also treat a few other things such as back pain, nausea, headaches. Then you have your retail clinics like CVS Minute clinics that you can treat for allergies, bumps, scrapes, burns, colds, and coughs. Those can typically be physicians or nurse practitioners and only take 15 to 24 minutes. And then as a last effort, we want to think about emergency rooms. But from a personal note, when we're all sick, the first thing we're trying to do is just get in and get out. But I would encourage you all to slow down and take your time with a physician. It's a time where you don't want to be there. You're looking to just get your prescriptions or your care and to go. But sometimes that can actually be the most costly. So I encourage you all to slow down, take good questions, take them to your physician, and then think, where do I need to go next? Because where you go matters. I can think of one situation recently with my own son that was taking a eardrop medication for a swimmer's ear, and the cost of that prescription ranged between $75 and $125. Use tools such as GoodRx. Think about what the cash price is for that particular prescription. Think about what it is and ask good questions so you can pay the least amount. The second story I have is an MRI that I've also incurred on my own knee. And I know that the doctor actually owned the MRI clinic, which was actually owned by the hospital. By simply asking some questions and shopping around, that MRI, which applies to my deductible that I have to pay, only cost me $450 by going to an independent facility versus paying over $2,500 for a facility that was owned by the doctor practice and the hospital. So I encourage you all to slow down and know that where you go matters. Let's look at your virtual care telemedicine. Benefits of virtual care visits is 24/7, 365 access to state-licensed, board-certified physicians. This requires less time away from work, no travel expenses, less interference with child or elder care responsibilities, and no exposure to other potentially contagious patients. Telemedicine is at a much further reduced cost, if not zero, for your plans. Doctor's offices can be a bit more expensive, followed by urgent care and emergency room, which can be cumbersome and expensive. One of the advantages of Anthem is the Sydney Health mobile app. You can download the app by scanning the QR code or registering at anthem.com/register. It has several advantages and everything can be done seamlessly in one app. Finding care, which doctors, hospitals are best for you. Looking at your health dashboard to see what's new on health topics of interest to you and wellness tips. You can chat, questions about your benefits or need help connecting with an Anthem representative. Virtual care, connecting directly from the convenience of your home. Community resources, and your own personal health records. One of the great features of Anthem is the WellBeing Solutions. You can earn up to $700 by participating in various activities that you'll see here on the screen. Anything from preventive wellness exams to mammograms, flu shots, and just updating your contact information. Each one of these requires different credits to be applied. You can claim those rewards by going to the Sydney app or going to anthem.com and going to your health dashboard, selecting My Rewards, redeem the rewards to see how much you've earned. You have 6 months from when the current plan ends to redeem reward dollars on electronic gift cards. Let's take a look at the dental plan highlights. There's a low and a high plan, Both have a $50 individual deductible or $150 for family. The low plan has a $1,000 per plan year maximum, and the high plan double that at $2,000. Services are covered for exams and cleanings at 100% on both plans, 80% on both plans for fillings, and major services such as crowns at 50%. Orthodontia is not covered on the low plan, but is covered at 50% up to $1,500 in a lifetime maximum on the high plan. Premiums are below. For the vision plan, did you know that a vision exam can also detect other health problems like glaucoma, diabetes, high blood pressure, and high cholesterol? So just by getting this exam can do a lot for your well-being. If you have an eye exam, you can get one every 12 months, and if you go in network, it's only a $10 copay. Lenses can be received once every 12 months. It's $25 in network copay for single, bifocal, and trifocal lenses. And frame allowance once every 12 months with a $130 allowance in network and 20% off the remaining balance. And finally, contact lenses, $130 allowance. We also offer employer-paid basic life and AD&D, as well as employer-paid disability offered by the Hartford. The life insurance provides 2 times your annual salary to a maximum of $100,000 in the event of your premature death. Employer-paid disability also includes 2 types, short-term disability and long-term. Short-term disability begins after 7 days of either an accident or an illness, and then will pay 60% of your base weekly wages to a maximum of $2,500 a week. The long-term disability then provides a 60% benefit of your monthly wages to a maximum of $10,000 per month after a 90-day wait. Voluntary life. This is extra life insurance that can be taken out payroll deduction. You can find all of your premiums based on your age and your demographics in Employee Navigator. For an employee, you can buy increments of $10,000 up to $500,000 or 5 times your earnings with a guaranteed issue of $200,000, which means no medical questions. A spouse can get increments of $5,000 up to 100% of the employee amount and get guaranteed coverage of $30,000. And finally, for children, 1,000 increments up to $10,000 or 100% of the employee amount. The guaranteed issue is the full $10,000. One of the great things we were able to negotiate with Hartford this year is no health questions. So this year at open enrollment, it is a true open enrollment for employees and spouses to go up to the guaranteed issue amount for voluntary life insurance with no medical underwriting starting May 1st. Let's review some of the supplemental health products offered by Anthem. Critical illness is the first. If you suffer a heart attack, stroke, major organ failure, kidney failure, cancer, progressive diseases such as Alzheimer's, or supplemental conditions such as a coma or permanent paralysis, these coverages can all be paid in a lump sum benefit. For you, you can choose a $10,000, $20,000, or $30,000 benefit. For your spouse, they're eligible for 50% of the employee amount, and for children, they're eligible for 50% of the employee amount. These coverages can help you pay for unreimbursed medical expenses when you have deductible and out-of-pocket expenses for these types of conditions. Next, we have accident insurance. Accident provides a set of benefits based on the type of injury you have and the treatment that you need. It provides a cash benefit directly to you in a lump sum tax-free payment. There's no medical questions or exam needed to enroll. You can take coverage if you leave, and there's no limitation for pre-existing conditions. A sample of benefits include things such as a coma, which will be $15,000 benefit. Hospitalization would include $1,200 per admission, then $250 per day, $750 per day for ICU. Ambulance benefits for $1,800 for air and $300 for ground, and concussions at $200 are just some samples for you. Your premiums are over to the right. And finally, the hospital indemnity benefits. Hospital indemnity provides a lump sum cash benefit to help pay for the cost with hospital stays when your health insurance doesn't cover it due to your deductible and coinsurance amounts. Why is this coverage so valuable? Cash benefit is paid directly to you in a lump sum tax-free payment. Covers hospitalization for normal pregnancy from day 1 with no waiting periods. You can take your coverage with you even if you leave your employer and keep the same rates for 3 years. And finally, no pre-existing conditions. As a sample, if you had a hospital confinement, for the first day you would receive $500, then $150 per day or $300 per day for ICU. As part of the Anthem Accident, Critical Illness, or Hospital Indemnity Plan, you can earn $50 for each of the plans by having a health screening, such as a mammogram, colonoscopy, fasting blood glucose test, or one of many common cancer screenings. You can receive the benefit by calling the phone number listed below and then submit your claim. A test will be confirmed and you'll receive the check. You and your covered dependents can each earn one $50 screening benefit for calendar year. Eligible tests are below. Now let's take a look at our Employee Assistance Program, also known as an EAP, by the Hartford. The Ability Assist Counseling Service is offered at the telephone number listed to the right and the website. If you're a first-time user, you can click on the registration tab and follow the instructions below. An EAP program is really there for complex challenges of life. The unexpected happens, and you just want a simple solution to help cope with the stress and life changes that may result. This is why the Hartford Ability Assist Counseling Service, offered by ComPsych, can play such an important role. It includes 3 face-to-face counseling sessions per occurrence per year and unlimited telephonic support for financial information and legal support and resources. For those of you enrolled in the high deductible health plan, you're also eligible for an HSA, known as a health savings account. An HSA allows you to save money before taxes are taken out of your pay and use those funds to pay for qualified medical expenses. You must be enrolled in the high deductible health plan only. Your funds are yours forever and roll over from year to year. You can invest those funds. Funds can be used for you, your legal spouse, or your tax dependents. Expenses include your copays, deductibles, prescriptions, those things that are qualified out-of-pocket expenses. And there's no use it or lose it rule, so your funds are available for current or future medical expenses. And your deposits are exempt from federal income tax. In 2024, pre-tax contribution limits include $4,150 for individual and $8,300 for family. If you're age 55 and older, you can do a catch-up provision that allows you to add an additional $1,000. As we get towards the end, here's some important information to know. From the left to the right, speak with your spouse or family members to determine what options are most suitable for you with your benefit needs. Log into Employee Navigator to make your 2024 open enrollment elections, whether enrolling or waiving in coverage, with a deadline of April 14th. Log into Employee Navigator to confirm or update your beneficiaries and your mailing address. Important, you cannot make enrollment changes outside of open enrollment unless you experience a qualified life change event, such as marriage, divorce, adoption, etc. Member ID cards will be shipped if applicable. And lastly, May 1st, 2024 is the new plan year effective date. What are your next steps? Log into Employee Navigator during open enrollment from April 8th to April 14th. Review your personal and dependent information, follow the online enrollment system prompts for open enrollment, and make sure to click on Complete to finalize your elections and print a benefit statement for your records. A confirmation email will also be sent to your email address on file. Thanks again for attending our 2024 open enrollment. As a reminder, you may always reach out to us for your one-on-one assistance needs. Insurance can be overwhelming, and it's complex, and Arista is standing here happy to help. Call us at 866-370-3119 or email us at help@aristacg.com.